My name is Harsh and I'm an entrepreneur and scientific educator. I make invisible food problems visible. We go through foods, conditions and habits and show you exactly how each one affects your digestion. Once you understand what's actually going on inside your body, you can stop guessing and start making decisions with a lot more confidence. Today, we'll talk about H. pylori. If you have H. pylori or think you might, this video will help you understand exactly what's going on inside your body. Once you see it, you no longer need to guess. You'll understand what stage you're at and what you need to do next. We'll go through symptoms, the tests, the 14-day treatment, the discomfort that comes with it, what to do if the bacteria is not going, and what to do if your digestion still doesn't feel normal. We've looked at more than 15,000 H. pylori cases in the last few years. So these findings come from real-world experiences, not just from textbook or papers. If you're looking for a specific answer, feel free to navigate straight to the chapter by looking at our timeline. H. pylori is a small bacteria that enters through contaminated food or water. It can happen to anyone. You could be a small kid or an old adult. Once the bacteria enters your body, it does two things. It creates a protective bubble around itself and it starts to drill into your stomach wall. Both of these make digestion very uncomfortable. The drill into the stomach lining, it exposes bare tissue. So what should have been soft and pink has suddenly become red. Doctors call this gastritis. If the bacteria drills towards the top of the stomach, it's called fungal gastritis. And if the bacteria drills towards the bottom of the stomach, it's called antral gastritis. Based on where the bacteria drills, people usually report different symptoms. Antral gastritis gives you heartburn, acid reflux, or stomach pain that usually goes away just after eating. But fungal gastritis gives you chronic fatigue, low levels of B12, or heaviness after eating. No matter where the bacteria drills, H. pylori is also known to affect both mood and skin. When your immune system tries to defend your stomach wall, it releases all these chemicals that make the brain move into a sickness state. In fact, one study shows that people with H. pylori are 2.5 times more likely to develop chronic anxiety than those who don't have it. Now, if you have these unexplained symptoms, you might want to go to a laboratory and test. But if you pick the wrong test or do it in the wrong way, you'll just end up wasting money and probably get a false result. There are 4 ways to test for H. pylori: biopsy, stool, breath, and blood. Biopsy is the gold standard way to check. The doctor will put a small camera inside your stomach and physically sample a couple of areas. But H. pylori usually lives in patchy clusters. So if the sampling is happening maybe 2 centimeters away from where the H. pylori colony is, the doctor might tell you that you are H. pylori negative, when in reality, you actually have the infection. That's why it's critical you get your endoscopy done by somebody who's experienced and a veteran, somebody who's been doing endoscopies for a long time. Next is the breath or stool test. These are designed to test active infection. That means if you take acidity tablets for a long time, you can actually fool the test. When the stomach has less acid, the bacteria doesn't need to work so hard to keep itself alive. So it goes into a dormant, sleeping state. Both the breath test and the stool test struggle to find a sleeping H. pylori. That's why before you do these, tell the doctor what medicines you're having and for how long. Otherwise, you might end up getting a completely wrong result. Last is the blood test. When you get H. pylori, your immune system makes antibodies to fight it. These antibodies are in your blood, and the blood test measures these antibodies to figure out if you are H. pylori positive or not. But turns out these antibodies stay in the blood much longer than the actual infection. Meaning if you get positive on the blood test, you won't know if you had H. pylori in the past or if you currently have H. pylori today. That's why most experienced doctors do not rely on the H. pylori blood test to determine if you actually have an infection or not. If you test positive, the doctor will recommend triple therapy. That's 2 antibiotics and 1 acidity tablet for 14 days. The antibiotics work to kill the bacteria, which means the bacteria goes away, the drilling stops, and your stomach is back to normal. But it doesn't quite work like that for most people. In fact, in our experience, in these 14 days, people make 3 common complaints: metallic or weird taste in the mouth, either diarrhea or constipation, and skin breakouts or low energy. I'm going to tell you why these happen. One of the two antibiotics given actually gets absorbed into the blood and then released into your saliva and spit. This creates a weird taste in your mouth and often can even lead to nausea. The antibiotics also end up killing both good and bad bacteria. They don't know which bacteria to kill, so they carpet bomb everything. This changes your stool shape and toilet urgency. Remember, stool is 70% water, 20% bacteria, 10% fiber. So the 20% bacteria is what gets ruined, and this causes stool to be either loose, unformed, or very hard. As these bacteria die, they burst open and leave a lot of toxins behind. So your immune system has to do extra work to remove all these toxins from the body. This often leads to people complaining of really low energy. Your immune system suddenly has to clean up this trash. This drains your energy. So it's very common in these 14 days for someone to feel worse before they feel better. So 14 days later, best case scenario, H. pylori is gone. The best practice is to do a stool antigen test 4 weeks after the last dose of antibiotics and 2 weeks after any acidity tablet, which means 1.5 months after you initially started the triple therapy, you can retest and check whether you are now H. pylori negative or not. But turns out most people don't actually do that. In India back in 2010, the H. pylori eradication rate with standard triple antibiotics was around 80%. Now in some regions, it's fallen to 60%. Meaning in some places, only 6 out of 10 people actually respond to antibiotics designed to kill H. pylori. And the number one reason for this, H. pylori has become very smart. When H. pylori settles, it hides behind a thick slimy blanket called a biofilm. Standard antibiotics hit the biofilm and bounce off it. They can't penetrate through, and that's why most treatments don't actually get to the bacteria hiding underneath the biofilm. It's like a bunker of sorts. So most people after that treatment will complain the burn is back, the bloating is back, the pain is back. They think H. pylori has come back. In reality, H. pylori never left. It was hiding under its protective blanket. So if the bacteria is getting smarter, even our approach to kill the bacteria has to get smarter. And turns out there's 4 specific ways to do this. Number 1, you break the bacteria's protective blanket. Number 2, you break the bacteria's acid neutralizing shield. Number 3, you make the bacteria stick less to the stomach wall. And number 4, you physically damage and you break the bacterial cell. A commonly accepted global intervention which does this is called Bismuth. Bismuth is a non-toxic heavy metal that turns into a thick paste when it goes into the stomach. Its unique properties break the biofilm open, prevent the H. pylori from sticking to the wall, break right through the H. pylori's alkaline bubble, and also interfere with H. pylori's ability to reproduce. That's why physicians nowadays combine Bismuth with triple antibiotic therapy. They call this quadruple therapy. And it seems to work. Success rates in many parts are more than 80%. They usually combine quadruple therapy, a very strict dietary limit on simple sugars because H. pylori loves feeding on sugars, and a very strong anti-inflammatory diet, which means low on dairy, low on gluten or any allergens, which is increasing inflammation in the stomach. The lower the inflammation, the better the environment for recovery. But despite the efficacy rate, in our experience, very few people opt for quadruple therapy. And the answer is not because it doesn't work. It has to do more with hope and faith. After an uncomfortable endoscopy, 14 days of digestive symptoms, when they're told they have to redo the 14 days one more time, most people lose hope and end up either changing their doctor or trying to self-medicate through natural methods. Here are 7 items people usually try, and I'm going to tell you what each one does and doesn't do. The first one, NAC, N-acetylcysteine. It was originally developed to break mucus in the lungs. Some studies show it does the exact same thing inside the stomach. It dissolves the chemical bonds holding the biofilm together. So the biofilm breaks and the H. pylori is totally exposed. So this behaves as a biofilm disruptor, but it doesn't kill H. pylori on its own. Mastic gum. Mastic gum is resin from the mastic tree. It contains acids which have an antibacterial effect to kill H. pylori, but it doesn't work much if the H. pylori is already hiding behind a biofilm. Broccoli sprouts. Broccoli sprouts contain sulforaphane which prevents H. pylori from building its alkaline protective bubble. It's what we call a urease inhibitor. Cranberry juice. Cranberry juice contains compounds called PACs which prevent the H. pylori from sticking to the stomach wall. It's like what Teflon does in your non-stick pan. it helps with anti-adherence. But that's not very helpful if the H. pylori has already burrowed its way and is very deep inside your stomach wall. DGL licorice. This works like a much stronger form of cranberry juice. It depends on how many flavonoids it contains. But again, it works only on anti-adherence. Sauerkraut juice. Sauerkraut juice contains L-glutamine, which helps to repair the stomach lining. This is genuinely useful, but it's for a different phase. It's for the recovery phase. That means it may not help to remove the H. pylori, but it will help to repair the damage done by H. pylori after you have removed the bacteria. The right product, but perhaps the wrong sequence. Apple cider vinegar. Apple cider vinegar helps to temporarily increase stomach acid. But if your wall is exposed or not healed properly, that excess acid may actually cause burning and serious discomfort. Use with a lot of caution. The honest summary is each of these 7 are actually pretty useful tools, but the sequence and timing matters. Remember, if you can't break the shield, you can't reach the infection. If you can't reach the infection, you can't start the next step, which is recovery. After all this effort, assume the bacteria is now truly dead. The job is still only half done because the bacteria has left behind it 3 broken things. The wall it drilled into, the acid system it disrupted, and the good bacteria, the antibiotics or antimicrobials wiped out. So wall, acid, microbiome. These are the 3 steps that are needed for genuine recovery from H. pylori. Until these 3 are restored, you will always feel like something is off, like your digestion isn't fully back to normal like it used to be before. Maybe you still bloat. Maybe your stool comes out loose or in unformed broken pieces. Until you move from remove the bacteria to repair the damage it's done, you probably won't feel like yourself again. Let's start with the first, rebuilding the wall. Your stomach lining has to be actively rebuilt. That means 2 things. Fill the gastric pits left behind and relayer with protective mucus. There are 4 commonly used options to help with the rebuilding process. Number 1, sucralfate. Sucralfate is a chemical that becomes a gel once it touches stomach acid. This gel then actually coats your stomach wall. It's like a band-aid for inside your stomach. People with a very damaged wall or prone to serious heartburn usually benefit a lot from this. But remember, it's temporary. The moment you stop taking it, the burn will come back. Zinc carnosine. Zinc carnosine physically migrates to the part of the stomach that needs help and stays there. Once attached, it activates your body's own cell growth signals, forcing new cells to divide and rebuild the lining from inside. Where sucralfate covers a wound, zinc carnosine actually helps to fill it. L-glutamine. We spoke about this one before. Your gut's mucosal cells use glutamine as their fuel source. Without enough of it, the rebuilding stops. Flavonoids. Flavonoids change the environment the new tissue is trying to grow in. It does 2 things. It triggers the body's own mucus production to protect the new tissue, and it also sends more blood to that tissue so that the tissue grows in a healthy manner. Without this, the tissue would still be growing in a very hostile environment and wouldn't hold up as well. So each of these 4 does a slightly different job when it comes to rebuilding your stomach wall. When it comes to stomach acid, the thing is, if you've rebuilt the wall, the acid usually balances itself on its own. Your stomach controls acid through a tight feedback loop between the cells that sense acid levels and the cells that produce acid. That loop can only work when the underlying tissue is healthy. And that's why building the stomach wall is usually enough to balance your stomach acid level. I've linked a totally separate article in the description of this video to help you go deeper. Replenishing your gut bacteria. And this is the biggest trap when it comes to recovery. Your microbiome as an adult is actually very resilient. Even after a couple of days of antibiotics, your microbiome comes back to normal in a couple of days or weeks. It's how the system is evolved. But a 14-day H. pylori antibiotic treatment is not normal. It's like a mass extinction event. And when billions of bacteria get wiped out, something else usually comes to take its place. Fungus. Fungi and bacteria both cooperate and compete for the same place. But antibiotics only kill bacteria. So fungus has 14 days to grow where bacteria no longer bothers it or is competing with it. The result is what we call fungal overgrowth, meaning too much fungus. And this usually comes with 4 clear signs. Number 1, gas, even after small meals. Unlike bloating that increases little by little as the day goes on, bloating with fungus is very fast. You eat a little bit of sugar and within 15 to 30 minutes, the bloating starts. Number 2, brain fog that feels like a hangover. Fungus produces a byproduct called acetaldehyde. That's the same compound your liver makes when it breaks down alcohol. So if you wake up foggy, flat, fatigued without even having touched a drink, your gut may be producing its own. Number 3, sugar cravings that feel uncontrollable. The fungal colony actively demands glucose to keep sustaining itself. So if you have completely unexplained pangs of hunger for sugar in particular, you might want to get checked for fungus. And number 4, histamine flares, skin reactions, flushing, stuffed nose, racing heart after eating fermented food. All of this because your fungus is damaging the enzymes needed to break down histamine. When there's a histamine buildup in the system, all of it starts coming out in your skin and your nose. Remember, if you have a lot of fungal overgrowth and you don't know it, and you start trying to eat a lot of fiber or prebiotics, you might make the situation worse because you're feeding the fungus and not the bacteria. That's why a lot of experienced gut health practitioners will first test for fungal overgrowth before they start you on your H. pylori recovery journey. The most practical test is called OAT, the organic acids test. Turns out when fungi are active in your gut, they produce a specific chemical byproduct that exits through your urine. This is called arabinose. And elevated arabinose levels on this test are a clear footprint of fungal overgrowth. This test is non-invasive, it's specific, and it's quite accessible. If testing confirms fungal overgrowth, there are usually 2 treatment options. Either you go down the chemical path with antifungals like fluconazole or nystatin, or you go down the natural antifungal path with products like oregano oil or capricolic acid, which comes from coconut oil. Just remember that when fungus dies in large quantities as you're going after it, it usually leaves behind a lot of toxic byproduct. One of those is acetaldehyde, the same compound that your liver makes after you drink alcohol. So again, it's very, very common to feel horrible before you feel better. People will complain of headaches, skin breakouts, extremely low energy and fatigue. This usually lasts 3 to 7 days. It means the protocol is working. One of the worst things to do in a situation like this is to stop on day 3 thinking it's the side effect or this particular reaction. It's called the die-off effect. Let's assume you've done absolutely everything. You've killed the bacteria, you've rebuilt the gut wall, you've removed the fungus, and suddenly 3 months later, again the infection is back. Most people assume the treatment has failed again. But in our experience, the answer is usually something different. That person has gotten reinfected, meaning H. pylori has come back. And usually it happens inside their house. H. pylori can live in saliva. So if your partner, spouse or family member carries it and they don't have symptoms, they can still keep passing it back on to you. Think shared towels, shared utensils, a shared bottle of water. Usually in these cases, the household needs to be tested together and perhaps even treated as one. Unfiltered water is the second vector. Washing vegetables with untreated water usually can reintroduce the bacteria very, very easily. Maintain your water filtration and treat it as a non-negotiable during your treatment phase. Raw and outside food is the third. Trying to go on a health binge to eat unprocessed salads or food that is not even steamed, it's very easy to have somebody whose hands are unhygienic pass on the bacteria to that food and from that food back into your body. During recovery, it's often recommended to stick to hot, warm or steamed foods to make sure that the chance of reinfection is coming down to very, very low. Everything we've discussed, Bismuth, biofilm disruptors, antifungal, zinc carnosine, these are all very powerful tools, but none of them work as well as your immune system. H. pylori was able to drill into your stomach and build a fortress there because your immune system couldn't fight it at the very beginning. Supplements and protocols can of course clear this path, but they cannot do the living for you. Sleep and clean food are not extras, they are critical and they're foundational. So don't think that you'll be able to get rid of H. pylori with a really poor lifestyle. You can take all these products, follow all the steps and still be H. pylori positive if you don't do the basics right. Living with chronic stomach pain is excruciating. It drains your energy, it steals your mood, and it makes you doubt every single thing you're putting into your mouth. But as you saw today, your body isn't broken. You just need to find out where you are in your journey and systematically address it. Stop guessing. Start planning. If you have any questions, feel free to write it in the comments below. Either me or my team would be more than happy to give you a reply. All the best and take care.